Dan Keyes graduated from UCLA School of Medicine. He completed an internal medicine residency at Cedars-Sinai Medical Center and then an emergency medicine residency at UCLA. He went on to Harvard to earn his Master of Public Health and then decided to complete a residency in preventative medicine at University of Pennsylvania.
Thank you very much, everybody, for coming. Thank you so much. Listen, we're going to talk about something that I hope will make you agree with me that we need a complete paradigm shift. Something that is revolutionary and yet ancient at the same time. So let's go ahead and dive right in and talk a little bit about lifestyle medicine. First of all, I'm just going to mention to you that I'm hoping to make the point that we need to be demonstrating these good behaviors, these lifestyle behaviors that make a difference. As Christine mentioned, I went to medical school at UCLA. I did my internal medicine residency at Cedars-Sinai Medical Center. I also went on to do some emergency medicine. I practiced a lot in the ER, but I think all of you who are here had the same experience. So maybe if you're an advanced practice provider, perhaps it's not exactly the same, but we all learned basically the same thing, and that's how to see a patient. And it's this basic approach that we take, right? We meet the patient, we do an interview, we do a physical exam, and then we come up with a plan, do some testing, we make a diagnosis, and then we treat the patient by providing a prescription or a procedure. Sometimes, we refer them on, usually we refer them on to somewhere else. Now, of course, this can be modified in different ways, as you know, and we may have to, in my ER, we admit 25% of the people that we see high acuity ER with a geriatric population. So the paradigm, though, is about like this. Take a look at this approach that we have. Think about it for a minute, that we're really in the business of end stage care. We are taking care of patients way after the disease process starts. And of course, being in the ER, that's exaggerated. It's for sure the case. But it's also the case, really, even primary care practitioner, how much time do you get to intervene before the illness really occurs? Most of the time we don't. We'll talk about that as we go along. And during my career, and you've all shared this with me, we see that the cost of healthcare has really gone up. It's skyrocketed over all these years. Now it's up to $11,000 per person, per capita, adults in the United States. So healthcare has really become expensive. In the United States, we're a lot higher than other countries in terms of the cost that we invest in this kind of healthcare. Probably the main reason is chronic disease is really, really high. It's going up all the time. This graph shows you a trajectory of chronic disease care in the United States. CDC actually says that 6 in 10 of American adults have a chronic disease, and 4 in 10 have 2 or more. We're talking about heart disease, Alzheimer's, diabetes, stroke, cancer. All of these kinds of diseases obviously are adding tremendously to the cost of healthcare in this country. The United States is an outlier. We spend far more per capita, even divided by our own GDP, the amount we spend on everything else. So I think you'll agree what we want to do is we want to intervene so that we're not seeing so much chronic disease. And in fact, that is the answer, if you will. I mean, it's a bold statement, but it's an answer to the healthcare finance crisis that we have in the United States. If we don't stop chronic disease, we will never solve this problem of going up and up and up in cost. Another point that's kind of sobering when you think about it is that we who provide medical care are influencing the health of that patient a small amount. As some estimates say that we do about 1/5 of the modifiable determinants of health, and in fact, 4/5 or 80% come from health behaviors, social factors, and the environment. We have a little effect on that, maybe partly because we're involved in end-stage care, as I mentioned earlier. People have talked for centuries and centuries, millennia actually, about this concept that the best way is to prevent disease and not just treat it, not just curative medicine. but actually prevent disease. And Hippocrates spoke about this thousands of years ago. Maimonides, about 800 years ago. Moshe ben Maimon, the famous philosopher and physician. So it's not really a new concept, and yet we've really ignored it in healthcare. I mean, we talk a little bit about it, but we really don't implement strategies to do these and put these in place. That is until about 1998. And you may have heard of this seminal study that occurred in 1998. Dean Ornish and a group took 28 patients who had coronary artery disease, and they tried a lifestyle intervention, and they compared controls who did not receive the intervention. It really opens your eyes. It'll show you kind of what the possibilities are. And you can see it was a 5-year program, and the lifestyle intervention was the main thing, 10% whole foods, vegetarian diet. They also did exercise, smoking cessation, and some counseling. You can see from this graph on the right that they followed people for 5 years, and they saw a reduction in the diameter of stenosis in the coronary arteries compared to controls, as you can see on the top here. And these controls were all taking lipid-lowering drugs if they were indicated. And you can see the red line would be if those who were not taking, so it would be even more of a dramatic difference. So a major pillar, this article, showing that heart disease can be reversed. There's also someone by the name of Dr. Caldwell Esselstyn. He just took patients who had been rejected as candidates for bypass in 1998, 1999, and put them all on a vegetarian diet. He also believes in not using too much in the way of vegetable oils. And he saw these reversals. I think one of his favorite photographs here, where you can see a widening of the LAD after being put onto the intervention. There's a great study, compelling study that was performed in 2009. There was actually a preceding study called the European Prospective Investigation into Cancer, and they had data available. And so these investigators from the US, actually, and I think some from the UK, looked at this data to see what kind of factors predict chronic disease. This study had 23,000 participants, not a bad size, very good size sample for a study. And there were 4 factors they looked at. They looked at people who never smoked, whether a person had a BMI less than 30, which, that's the definition of obese, not just overweight, but actually obese, 30 minutes a day of exercise, and a diet that's plant-based, whole grain, and low meat. And you'll see that that's a theme that goes through all of these lifestyle interventions, not a lot of meat in the diet. So what do they find? This is what they found in their study. They said that for those who had all 4 healthy behaviors, they had a hazard ratio that was a mere 22.22, 78% less than those who did not do these types of lifestyle changes. It's really amazing when you think about it that we have nothing in medicine really that makes such a huge difference in someone's health as this. Just a major difference in avoiding chronic disease if you can do these 4 things. So how many people in the US actually do that? They went back and looked at some other data, a different group. This is not quite the same study, National Health and Nutrition Examination Survey data. And they looked at an accelerometer to see if people were moving, they're eating a healthy diet based on the US Agricultural Department, non-smoker. They tried to estimate the same parameters. And what did they find? That less than 3% of Americans, of all adults, had these 4 healthy lifestyle characteristics. It's like this amazing gift that we have, and yet people are not taking advantage of it. I like to tell my patients that what we're talking about is a choice between our current lifestyle and a lot of future pain. And it's all about convincing people to try to make those changes so they can avoid that. What about obesity? Obesity is a huge trend in the United States. This is back in 1985. You can see from this diagram that no state in the union had more than 14% average obesity, BMI greater than 30. And you can see how this increases over time. Now the beige is over 20%. This is in the year 2000. 2005, you're seeing over 30% now, a few states. And here we go in 2010, which is the latest data I can show you from the CDC, that we have in Michigan, and we're leading the charge, greater than 30% of our adult population is obese, defined as greater than BMI of 30. It's startling and it's crazy, and it's certainly very bad for people's health and for chronic disease. So what about intervening for these things? We want to make a difference. Well, there's a lot of evidence out there on diet, exercise. I've tried to glean a few of these for you, and I'll admit that I got some of these from my colleagues at the American College of Lifestyle Medicine, and something I'm going to talk to you about later where you can also access this. The studies tend to suggest that you have more fruits, vegetables, grains, unprocessed foods, and avoid meat. We're not talking about vegetarianism. Remember that previous study I showed you, which was from the European Cancer Study, and they took that data and saw those 4 characteristics. They're not talking about vegan diets, even vegetarian. They're just saying limited amount of meat. So it's not very often, probably like our ancestors used to do. People didn't eat meat every day like, Americans do today. And you can really make a huge impact on obesity. And there's a lot of literature about this. There's one study, Schlesinger study, I thought was quite interesting, where they looked at myofat in the muscle itself and saw that people who eat, the top one is vegetables, you could have a decreased relative risk the more you do vegetarian diet. And the more red meat you eat, the greater it goes up. And you can imagine why. There's probably a lot of reasons, but one of them for sure is the saturated fats in meat. Of course, you get saturated fats in butter, in cheese, and all these different things. And I come from a French background. My first language is French. Man, do we love cheese. But I've really limited it in my diet because you know what? The trade-off is pain and suffering in your future. And I think that's an important trade-off, and I'm willing to make it if I can avoid some of that. What about diabetes? There's also quite a bit of literature that looks at this. I'm going to show you the Adventis study in a moment, but here's one by Knoller et al. That looked at a lifestyle intervention where they tried to reduce weight with variable success. Weight loss is always a challenge. There's no question about it. So they tried different kinds of interventions. They looked at placebo, metformin, and these lifestyle changes, which again was a predominantly vegetarian diet and exercise. And you could see here that actually lifestyle outperformed metformin in terms of prevention of diabetes from prediabetes. And they tried to compare Atkins, Zone, Weight Watchers, Ornish. All of those were successful at losing some weight. And I think it's no surprise to any of us what made the difference. It was adherence to the diet. Now, I personally not in favor of Atkins because Atkins can include all kinds of saturated fats and meats that really are not good for you. And there is some benefits out there that people can for sure lose weight using Atkins. No question about that. But in fact, they don't have a decreased mortality. They have an increased mortality. So I don't advocate for that particular diet. But there's no question we need help in trying to come up with better strategies for weight loss. This is something that is obviously a core issue with lifestyle. It seems like a vegetarian diet, though, helps quite a bit with that. Here's another study called the Portfolio Diet. Many of you may be familiar with some of these studies as they came out during your career at some point or another. This was back in 2003. They did, again, dietary changes. This was not vegetarian per se, but they tried to have whole wheat, low-fat dietary foods. As you can see on the left, they tried to add some plant sterols as well, which come naturally. You don't have to really take them in a capsule form. You can get them in your food by eating green leafy vegetables and vegetables in general. And you can see here what happened, that if you look at the LDL and the LDL ratio, they went really down. You see the triangle is the diet, the Portfolio Diet, and a statin was essentially the same, really no difference. So you can actually duplicate the benefits of a statin by using a diet that is predominantly of this nature, lifestyle diet. Here's the Adventis study that I told you about. It's really fascinating, and it's a big study. They had 96,000 patients, basically 100,000 patients. So it's a really good sized longitudinal study comparing vegetarians to meat eaters. They looked over time, this is a decade, and they found the following. They found that people who are vegetarians had a lower all-cause mortality and lower for all of these different things, including cancer and some other diseases. We'll see that diabetes as well is less common among vegetarians. But I thought there's a really fascinating thing here. The article says, well, it's better to be a vegetarian. But if you look at the subgroup analysis, and I think this is really fascinating, within the vegetarians, they had vegans, they had lacto-ovo vegetarians, and they had pescatarians. So that's basically a vegan who eats fish. If you look at the confidence intervals, I get to choose evidence-based medicine to my residents, and you'll see that confidence intervals should not cross 1 if there's a significant difference. And when you look at the vegans and the lacto-ovo vegetarians, they actually touch on 1, technically non-significant because the confidence intervals cross 1. The only group that did not cross 1 were the pescatarians, the people who ate fish. So personally, I tell people, like, if they want to get off of meat, but they don't want to give it all up, try to emphasize fish in your diet, because by the Adventist study, it really seems like that makes a difference. Again, we're talking about decreased mortality and decreased diabetes. What about physical activity? These are some of the pillars of lifestyle medicine. We talk about diet. Diet, it can't be overemphasized. Diet is huge. What we eat is basically what kills us, just as Maimonides said 800 years ago. It has not changed. But physical activity is also critical. And you could see from this graph that the more physical activity one performs, the lower the mortality. This is very steep at first and it starts to level off. And so somewhere around here, I don't know if you're seeing my pointer or not, but you can see where in this bracket down here, 150 to 300 minutes. If you do 150 minutes a week, you're getting the vast majority of that steep part of the mortality curve. And that's why the U.S. Preventative Services Task Force tells us, physicians and our patients, we should all be doing 150 minutes of moderate exercise. We're not talking about, running sprints in the Olympics or marathons. We're talking about 30 minutes of moderate activity. People use sort of as a rule of thumb that if you can walk and talk but not sing, that's considered moderate exercise. What I'm doing now on this treadmill. If you walk so hard or exercise so hard that you can't talk anymore, that's vigorous exercise. We're not talking about vigorous exercise here. We're talking about moderate exercise, 150 minutes a week. That's 30 minutes a day, 5 days a week. Now, that study we talked about earlier, as you recall, said to do 30 minutes, 7 days a week, which is 3.5 hours. So probably better. But I think you can agree that you get most of your benefit up front, but you've got to be active. You've got to be out there and doing some exercise. And this is, of course, what we need to be telling our patients. What about sleep? This is another area of emphasis in lifestyle medicine. We should be trying to get enough sleep. And there's some recent literature, and I didn't provide it for you today, suggesting that maybe a lack of sleep might contribute to having Alzheimer's as well. And I didn't bring that for you today. But if you look at all-cause mortality, take a look at these curves published in the American Heart Journal. And you can see that the mortality decreases to about 7 hours. Then they have some subsets of different kinds of disease. But it looks like 7 to 8 hours is very helpful to get. And I'll tell you, many times during my career, I'm an ER doctor, shift worker. I thought I took a little pride. I don't need that much sleep. It's okay. But now I realize, I look back on it, I think, well, maybe what I should have said, well, it's okay. I smoke. I don't care. I don't smoke. But it's kind of the same thing. We should be trying to get enough sleep. It's not something to be proud of, just that we can, I can get by on a lot less sleep. Because the whole concept I'm trying to get across today is that we need to do everything possible to avoid future pain and suffering in our own lives and in our patients' lives. The goal here is to do everything that's not that hard to do. Almost every person can do this. Obviously, there are people with disabilities that can't do everything, but they can find their own way perhaps. But everybody should be trying to minimize future suffering. We of all people, the physicians, we should realize all the bad things that can happen to people. Stroke, heart attacks, kidney failure on dialysis. These are mostly preventable. I don't want to exaggerate. There are cases otherwise, there might be some, I'm a toxicologist. There's toxins that destroy your kidney. I'm talking about the vast majority of us can take advantage of these things and avoid lots of future suffering. So these are the pillars of lifestyle medicine. What I'm telling you about today, it's a new field, even though the whole concept is not new at all. Point we made earlier. But it's like the concept is this. There are these other fields out there like functional medicine, integrative medicine, and I don't know as much about them. I'm certainly not going to say anything bad about them, but I think they're usually more based on a philosophy. What's different about lifestyle medicine is it's like all the other specialties that you and I are used to in medicine. They intended to be based on evidence, medical studies, on research and evidence, and we implement strategies that are proven by evidence-based medicine. So that's the difference. It's all about trying to find out what works, and what we do know works, trying to implement those things. So here's the list. We talked a lot about nutrition. It's the top one up here. It's a little faint. That's got to be the most important. I think nutrition and exercise are the most important, but sleep, a lack of quality sleep, can really impact your health in many ways. Substance use. I haven't talked about that, but there's no question the number one killer for a person who smokes is their tobacco. And the number one thing anyone can do for their health if they're smoking is to stop smoking. And so obviously taking toxins, if your patient's addicted to alcohol or smoking, then these are things we definitely need to do. They're top of the list, getting people to stop smoking. Stress management, social connections, all of these things are important. We try to base our advice on evidence, medical evidence. So if I've at least made you think a little bit about how we can prevent disease and how important it is to prevent disease, and how that seems to be even maybe more important in some ways than curative medicine, which is what you and I mostly do. Most of us do end-stage care. What do we want to do? We want to get to the public. We want to reach them and get this message out. So I want you to know that this is what you're up against. Choose wisely, choose Wendy's. And they're telling people all the time in every type of media that you should be doing this. You should be having what they have to offer. Now, I hope you can hear this.
Only Wendy's serves a better breakfast with a better bacon. A hot buttery treasure loaded with a fresh cracked egg, cheese, and sausage or bacon. And to top it off right now, it's just a buck. A buck. Now there's no reason to go somewhere else. Choose wisely. Choose Wendy's.
So you take a look at that picture. It's the best example of exactly what you shouldn't eat. Empty carbs, you have bacon and processed meats are killers, really. Did you know that processed meats have been added to the IARC's list of level 1 carcinogens, up there with all these well-known carcinogens like arsenic, But importantly, we really should be avoiding all types of processed meats. It's just bad for you. You're going to have colon cancer, God forbid, all kinds of bad outcomes from that. Not even just cancer, but other health issues. And I just want you to know you can get Wendy's anywhere around the Detroit area. See all of these sites where you can pick up your bacon cheeseburger and narrow your coronary arteries rapidly, as you can see from this Google map that I recently conducted. I think the only maybe good thing is that you see Sinai Grace is located somewhere right in the middle of there. So if they need some health care, then they can get it. Bad stuff. But one thing you certainly can get easily also in Detroit, these are liquor stores. They're definitely in abundance of those all over the place. So you may not be able to get good food, but you can certainly get liquor. Now let me tell you about this case. Somebody I saw, and yes, this is a stock photo. This is not the actual patient. But she was a 58-year-old female. She had 5 prior stents, cardiac coronary artery stents, and she was being admitted now for chest pain. This is what they gave our patient for breakfast. Now take a look at this. I mean, it's just full of saturated fats, processed meat. I think there's one vegetable here, and it's a potato, and I think it's fully saturated, though, with saturated fats. We in the hospital should not be giving patients something that is bad for their health, right? One thing that happened in, I think, 1998, if I'm not mistaken, maybe it was a little bit before that, is they decided that no hospital would allow smoking on their premises, on their campus, because we know smoking is deadly. It's terrible for you to smoke. No hospital allows it anymore. And that set the trend for all these federal facilities, and all these other people then started not allowing smoking in their facilities. We should be doing the same thing with these kinds of foods, which are obviously just terrible for everybody's health, causing suffering in their future. So let's talk about us. We are the practitioners here, right? We're the ones who provide care. It's not all bad news. There's certainly some opportunities for us. First of all, I'd like you to think about maybe trying to do this in your own home, trying to implement these things in your own life. You can keep it really simple, probably not really appealing to you, or you can get a little bit more complex, like the soup that I like to prepare in my house. So I like to saute some onions, chop up some carrots, first start boiling the whole thing, chop up some celery, I put some quinoa in there, some split peas, which are great for protein, and lentils. They're also excellent fiber. Fiber is really excellent for you and also helps prevent colon cancer, the number one cancer, or the number two cancer in both genders. I guess it's that way, right? Stir it up, add some spices. I like garlic in our house. We always have a lot of garlic in there. Put some turmeric in there. And of course, don't forget a glass of wine on occasion. So I want to make this point. Françoise Marie Arouet, who is also known as Voltaire, said, "Perfect is the enemy of good." The first step in trying to implement this in your life is to just do some of it. Try to cut back maybe on the amount of meat or saturated fats that you take. Start doing some exercise if you're not. If you're already exercising, but not 150 minutes or 200 minutes a week, then try to increase it. Find ways to entertain yourself or learn while you're doing your exercise so that that's not time lost. And I want to make another point for you. Think about this. Who are you working for as a practitioner? You're probably working not just for yourself, but you may have a family, you may have children that you're supporting. That's why you go to work every day, right? You're earning money and you're trying to support them. Well, don't you also want them, if I can make the case, and I'm probably preaching to the choir here, that you want them to have a healthy life. You don't want them to grow up and suffer and have to have their chest cracked open for a bypass or have a stroke and be disabled or be on dialysis. You don't want that for your children. So we should be teaching our children this. And how do you teach them? You do it by modeling. Change your own life and then start talking about it in your own families and trying to get them to adopt these activities. It's all about avoiding future suffering in ourselves, in the people we love, and also for our patients. I would advocate that every time you see someone clinically, every single one of those encounters, you should include a word about prevention. There's no question there's not a lot of time. It's a real problem finding time to implement these things in a busy practice. But always mention some aspect of prevention. Get that message going whenever you see a patient. So this is pretty much it. If you have a QR code scanner on your phone, you can go ahead and put it right up to the screen.
This will take you to the webpage of the college. I'm not a paid spokesperson for this college.
I'm just all about getting more people to do this because this is what really makes a difference in health. So I hope I gave you enough time to do the QR code. If not, you can go to lifestylemedicine.org and it'll take you to the same place, lifestylemedicine.org. Okay, I'd love to hear from you. So I'm going to stop talking and turn it over to Christine to allow anyone else who has a question or comment, please, by all means, jump in and tell us what you think.
Thank you, Dr. Keys. I feel like you should hydrate at this point, right?
Yeah.
In the meantime, there's clearly been some great positive comments. Any other questions or comments?
Dr. Keys,
Please.
this is Gil Anderson. Look, I was impressed. I've never seen a grand rounds given from a treadmill before. and you're not even winded.
Bye.